Maybe you've heard about Original Medicare and a lot of talk about Medicare Supplement and Medicare Advantage plans, but honestly, you just want to know what plan is best and why. If this is you, then stay tuned because today we'll find out what the best plans are currently and why. Hello everyone, my name is Rick Teska, CEO and licensed advisor here at Strive Medicare, and today we'll briefly introduce Original Medicare, Medigap plans, and Medicare Advantage plans, as well as cover the best types of plan in each category. Before we get started, make sure to like and subscribe so you don't miss out on any of our new videos. So to introduce Medicare, it is a government-run health insurance program for people 65 and over, and people under 65 with certain disabilities. It helps people pay for some of the cost of medical care, including doctor visits, inpatient hospital stays, and prescription drugs. Medicare also consists of different parts that each cover a different set of medical costs. Original Medicare, known as Parts A and B. Medicare Part A is going to cover inpatient hospital stays, skilled nursing care, and some home health care and hospice care. Part B will help cover doctor visits, lab tests, medical equipment, and outpatient medical services, and some preventative care. There's also Medicare Part D for drug coverage, but we're not going to talk about that in much detail today. The problem with Original Medicare Parts A and B is that they do have coverage gaps. For example, Medicare Part A will be free for most people at age 65, but it will have a $1,600 deductible for inpatient hospital benefit period. Part B is going to have a $164.90 premium each month and a yearly deductible of $226, and it will only cover 80% of things for medical necessary care and preventative care. This means apart from any insurance coverage, you could be paying a lot of coinsurance and deductibles. This is where you may have heard of plan options like Medicare Supplement or Medicare Advantage plan to help fill some of the coverage gaps associated with Part A and B, so you're not paying too much for services covered under Part A and B of Medicare. The question is, which option do I go with to help bridge these gaps? When it comes to these two options, the first option is to purchase a Medicare supplement to work with Original Medicare benefits. Depending on the plan you choose, a supplement is going to pay for those costs associated with Original Medicare, like Part A deductible, Part B coinsurance, Part B excess charges, and more. To get an understanding, I have a chart here of the plans by letter and the gaps each letter plan fills. Now, the three Medicare supplement plans on this chart to consider are going to be Plan F, Plan G, and Plan N. These three plans are currently the most popular plans in the Medicare supplement route. However, note that Plan F is only available to those who went on to Original Medicare before 2020. These plans have no networks, so you can see any provider that takes Medicare. When it comes to these plans, Plan F is obviously going to be the Cadillac of plans. This plan will have a higher premium, but it's going to cover all of the gaps that we listed. This means that as long as you pay your premium on a Plan F, you won't have to worry about any deductibles, coinsurance, or copayments associated with Original Medicare's Part A and B. All you have to do is pay for your Part B premium and the Plan F premium, and all services included Parts A and B will be fully covered. The most popular option for those who are new to Medicare in 2020 or later is going to be Plan G. The only difference between Plan G and Plan F is that with Plan G, your premium is going to be less each month, and you'll still be in charge of paying your yearly $226 Part B deductible. What this means for Plan G is that as long as you pay your Plan G premium, your Part B premium, and hit your Part B deductible, all other coverage associated with Medicare Parts A and B will be fully covered. Finally, the popular alternative to Plan F and Plan G is going to be Plan N. The only difference between Plan N and Plan G is going to be, again, a lower premium, a rare excess charge rider, a small $20 copay for office visits, and $50 copay for emergency rooms. However, note that you are not in charge of paying the $50 copay if you're admitted to the hospital from emergency room. Also note the excess charge comes when a doctor does not accept Medicare's pricing. In many states, there are no excess charges, and even in states that there are, they're very rare, as the majority of doctors will accept Medicare's pricing. To recap, the Medicare supplement route is a great way to fill the gaps of original Medicare, and the best option to consider for these plans, again, are Plan F, G, and N. Also remember that there are no networks, and you can see any doctor that takes Medicare. The second option to help fill the gaps of original Medicare is going to be what's called a Medicare Advantage plan, also referred to as Medicare Part C. These plans are an alternative to original Medicare. Part C is administered by private companies and replaces your Part A and B benefits, and will often include Part D drug coverage. Now, the only requirement for these plans is that they must cover at least what original Medicare covers. These plans are going to have low or no monthly premiums, but they'll have more than higher copays and networks when compared to a Medicare supplement. The most popular kinds of Medicare Advantage plans are Health Maintenance Organization plans, or HMOs, Preferred Provider Organization plans, or PPOs, and Special Needs plans, or SNPs. Health Maintenance Organization plans, or HMOs, utilize in-network doctors and require referrals for specialists. When it comes down to these plans, you'll only be able to go to the doctors and specialists and hospitals in your plan's network. This means you will not have coverage when traveling. You will also have to pay co-payments and most services, and if you go outside of your network, you'll typically incur the full costs of the services. Preferred Provider Organization plans, or PPOs, also have networks. In networks, they will be very similar to an HMO. The plan difference is that these plans will allow you to go out of the network for certain services like seeing specialists. Please note that services out of the plan's network will be covered, but you will typically have a higher copay or coinsurance for services outside of the PPO's network. If you can find a good PPO plan, we would typically recommend these plans over HMOs because of the ability to go out of your plan's network. Finally, special need plans, or SNPs, are special need plans that certain Medicare beneficiaries can qualify for. The two most common types of special need plans beneficiaries will qualify for are dual special need plans or chronic special need plans. Dual special need plans, or DSNPs, are available to those who qualify for both Medicare and Medicaid. A beneficiary's Medicaid eligibility level will determine which DSNP they qualify for and how much they'll pay. For example, someone who has Medicaid eligibility, full benefit dual eligible, will typically be fully covered in any of these plans. When it comes to chronic special need plans, these plans will cover the costs associated with Medicare Advantage plan for specific chronic conditions. So just to recap, we talked about original Medicare, the coverage gaps, and the two routes that you can take to fill these gaps. We also talked about the best coverage options in each of these two routes and why. Here at Strive Medicare, we represent over 30 carriers who carry these types of plans. If you're still confused about which plan option is best for you, there's no need to fret. We have licensed advisors here standing by who offer free educational and guidance into these plans and will help you find which option is best fit for you. If you have any questions or need guidance into a plan, call the number on the screen or comment in the comments section below. We also have a link to schedule a phone appointment in our comments section as well. Thank you for watching.